In this week's assessment of the pandemic and modeling from the Institute for Health Metrics and Evaluation, I think we're seeing the continued critical role of the Delta variant driving transmission in many parts of the world. We're seeing most of North America with substantial surges. For example, surges in the US that were actually faster than we predicted last week. So the surges are accelerating. We're seeing in Europe these very large surges in many tourist destinations: Spain, Cyprus, Malta, Greece, also big surges in the Netherlands, much smaller surges in other parts of Europe. And then in Central Europe, it really hasn't started yet. We're seeing a peak in transmission, we think, in Russia, which is certainly good news because of the large Delta surge there. But we're seeing Delta surges, throughout West Africa, North Africa, East Africa, Southeast Asian surges in Indonesia and Thailand and Vietnam, Cambodia keep accelerating. So the theme of what we saw last week, which is the Delta surges continuing, we are also seeing in our forecast models that at the global level, because we've made a revision to how we think mobility will evolve, there's no evidence that mobility is declining in response to these surges in most places. And we think that we've taken that into account in this week's model. So our forecasts for the next 4 months are up at the global level. It's particularly true in parts of the world like Southeast Asia, much less of an effect of those revisions in the US or in Europe. So our forecasts, have this surge continuing. It goes up at the global level until early September, comes down a little bit, and then as the Northern Hemisphere late fall winter surge starts to take off, we expect the numbers to creep back up again. So quite a complex picture, but one that is really dominated by how the Delta variant evolves. I think the critical question in understanding the hospitalization and death that we might expect to see is really how effective are the vaccines, first, vaccine by vaccine, at preventing infection. That's built into our model. We've done our systematic review of trials and post-vaccination studies and built that in. But then the part that's less well understood is the effect of the vaccines for the Delta variant on preventing hospitalization and death. We know quite a lot about preventing symptomatic disease, and that's built into our modeling. But the studies that focus in on hospitalization and death have, many of them had too small numbers to have narrow enough uncertainty intervals for us to adjust our predictions on the basis of the difference between symptomatic disease and severe disease leading to death. That evidence is starting to accumulate in places that have had a lot of hospitalization, such as the United Kingdom, due with the Delta variant. And so we expect we'll be able to better reflect that in the future. But to get that data on how good are the vaccines, vaccine by vaccine against the Delta variant, countries do need to be reporting disaggregated data by age, by sex, and vaccination status. And in some countries, that's happening, in the United Kingdom as examples, but that's not happening in many, including the United States, where it's actually quite difficult to get information on breakthrough infection. And there's actually been guidance from CDC discouraging the testing of asymptomatic individuals that are vaccinated or even mildly symptomatic unless they end up in hospital. And so it's sort of making it harder for us to see what's happening to, how good are the vaccines, mRNA compared to the less effective vaccines for the Delta variant, for that critical outcome, hospitalization, and also even more critical, death. So we hope that there'll be more reporting of that sort of data in the future. That'll get us in a better position to understand not only how we can rely on the vaccines as the main management strategy, but also as waning immunity from natural infection and waning immunity from vaccination starts to kick in, we should expect vaccine efficacy to also be changing. And so having good surveillance is going to just be critical as we manage both the current Delta surge, likely fall winter surges in the Northern Hemisphere, and the strong prospect that there will be other variants that emerge that we must understand quickly so that we can help understand, which communities are going to face major surges from COVID and plan accordingly.